Hi, my name is Heidi Hazy, and I am a DNP student at Palm Beach Atlantic University. I'm presenting a case study on neoplasia, more specifically breast cancer. I chose this case study because my mom and grandmother are breast cancer survivors of 4 and 2 years. My mom is almost at that 5-year mark, and it's very exciting. Breast cancer is definitely a subject that hits close to home, and it is something that I only wish we could find a cure for. This case study is about a 41-year-old woman who presented with a mass in her left breast. During a self-examination, the patient initially noticed a tiny nodule, which doubled in size during the last 2 months before presentation. Family history is significant for a maternal aunt who died of breast cancer at age 59. No other cancer-affected relatives are noted. The patient has 2 young daughters. Physical examination revealed a mass which was non-fixed in the left breast. No signs of edema or nipple changes were evident. A single palpable axillary lymph node, which was also mobile, was found. Mammography confirmed the presence of a mass 2.5 centimeters in diameter. CAT scans of the chest and abdomen revealed no masses in the lungs, liver, adrenal glands, kidneys, spleen, or ovaries. A bone scan was negative as well. Serum calcium was elevated at 12.5 milligrams without specific signs or symptoms, and serum PTH was slightly low. The patient underwent a modified radical mastectomy to remove the tumor, including axillary lymph node dissection. Of the 14 lymph nodes removed, 1 was completely replaced by tumor cells, and 3 others showed microscopic involvement. Immunostaining of the tumor for von Willebrand factor is shown in a computer image. In addition, the carcinoma cells stained intensely for HER2 expression and were positive for the estrogen and progesterone receptors. Viable tumor cells were dispersed and analyzed by flow cytometry for DNA content, revealing a high proliferative index without aneuploidy. Based on clinical staging, the patient was given adjunctive radiation therapy to the left breast and axilla. The patient presented 10 months later with complaints of headache and blurred vision. Cerebrospinal fluid was analyzed. I really like this article because it provided some really great general statistics on breast cancer that I felt was important for people to know. Breast cancer is the second most common type of cancer among women in the United States after skin cancer, and it is second only to lung cancer for U.S. cancer deaths. Approximately 30% of newly diagnosed cancers in women each year are breast cancer, and about 12% of women with breast cancer diagnoses develop invasive disease during their lifetime. Despite these statistics, breast cancer incidence rates in the United States are decreasing. After rising rapidly in the 1980s and 1990s in conjunction with widespread mammography screening, incidence rates began decreasing in 2000, with a 7% decline in 2002 to 2003. Experts speculate that the large decline was caused in part by decreased use of hormone replacement therapy. The decrease in mortality is attributed to advances in treatment, reduced use of hormone replacement therapy, earlier detection, and increased awareness of the disease. This is why it is so important to get our communities educated and have this awareness of not only breast cancer, but all cancers. I found this article interesting because we recently discussed in our research class how there are several studies that are looking into the use of low-dose NSAIDs like aspirin and whether they can actually reduce a person's risk for many different illnesses such as heart disease and strokes. So when I found this article, I just had to read it. This study took 133,479 women and studied them for 10 years. Over those 10 years, there were 1,457 cases of breast cancer. In 23% of the women, they reported taking low-dose aspirin 3 times a week. It was found that there was a reduction of 20% reduction in risk of developing HR-positive or the HER2 negative breast cancer. It was decided that they would have to do further testing to see if daily use or using a regular strength dose of aspirin would have an effect instead of the low dose 3 times a week that was used just for pain relief reported in this study. I chose this article for my case study because I witnessed firsthand how cancer can affect someone mentally, physically, emotionally, and financially. Breast cancer had a negative impact on both my mother and grandmother in all aspects. They both had reconstructive surgeries, had financial struggles because the treatments are not cheap. Their treatments were physically and emotionally taxing. Breast and cervical cancer are the most common cancers affecting women, affecting approximately 1.67 million and 530,000 people each year worldwide. This study investigated the quality of life of breast cancer and cervical cancer survivors. The World Health Organization defined quality of life as involving a person's physical health, psychological state, degree of independence, social relationships, personal beliefs, and environment. Female cancer survivors are faced with physical, psychological, and social distress in addition to fatigue, irritability, memory loss, decreased energy level, and reoccurring pain and decreased quality of life. The symptom distress experienced by cancer survivors is a critical factor in influencing their quality of life. The participants were given surveys with various questions ranging from body image to lack of appetite to fatigue, financial difficulty, cognitive functioning, and emotional functioning. The results found that patients were happy to be through with treatments and to be survivors. However, they were all affected on all those levels. Most had physical pain from surgeries and needed some type of physical therapy. They were exhausted, and some were malnourished from chemotherapy treatments, from not being able to eat, and by changing the taste buds. They also had financial struggles because treatment is expensive, even with insurance. Overall, once cancer has been treated and people are considered survivors, these people need help, whether it be needing physical therapy or even psychological consultations. Breast cancer is something that hits home with me. I've seen the effects that the treatments and just the diagnosis itself can have on someone. These people do need help, and they need the support from friends and family.